Good morning, Madam Chair and Vice Chair Warnick. And I want to thank Representative Orwell for her steadfast leadership, along with you, Madam Chair, and others, Representative Davis as well, and Jen Stuber. It's been really an amazing process with a really interesting work group that has brought together a huge number of partners, and I've been very impressed by that. My name is Laura Van Tosh, and I live in Seattle, and I want to say that the story I'm about to read is my own, but it is not unlike others. The year was 1979. At 17 years old, I made a run for the automatic doors inside the University of Washington emergency room, only to be chased down by two men and then flipped over like a pancake face down on a bed, put in 4-point restraints and injected with Thorazine while screaming that I was going to die. That was my first experience with crisis services. 1996 found me in Tampa, Florida, walking the yellow line in the middle of a busy street. I landed in an ER, restrained to a bed, until I was placed in a, quote, short-term stabilization unit. This experience put layers of trauma atop post-traumatic stress disorder. 2012 came around, and while homeless, I had multiple criminal justice interactions. My engagement with crisis services improved 1,000-fold from 1979 because I met CAHOOTS, Crisis Assistance Helping Out on the Streets. The National CAHOOTS Act was introduced by Senator Ron Wyden of Oregon this week in Congress. Similar to crisis response teams in 988, it is an unarmed crisis intervention that puts skilled behavioral health workers, including peer workers, in the front seat of this community-based model. It has been said that our systems are broken. Dr. Andy Keller of the Meadows Mental Health Policy Institute has said, the mental health system isn't so much broken as it is misdesigned on a fundamental set of inequities. I challenge us to rethink how we label the system as broken, especially on the other hand, when we need to attract new workers to the field. The trajectory of crisis services I have used clearly indicates progressive reforms have been made to our system. Please, let us continue to make needed improvements rather than stand still. 988 definitely will get us closer to fine. Thank you very much.
Thank you so much, Laura, for your testimony. Next up is going to be Chris Bandoli.